Hi, my name is Clayton Jensen, and I would like to share with you my final project as a nursing informatics student about the evaluation and optimization of an inpatient daily cares flowsheet. Now, before I continue, I would like to set the stage a little bit about what a daily cares flowsheet is. The daily cares flowsheet is a flowsheet regularly used by nurses and healthcare aides to document routine cares provided to their patients. Now, in this particular daily cares flowsheet, you can divide it up into three different levels. You have categories, kind of like hygiene, data elements, bed bath, and values, which are the actual things that the healthcare aide or the nurse did pertaining to the data element, in this case, a bed bath. Now, total in this daily cares flowsheet, you have 10 categories, 69 data elements, 443 potential values to select, which means that you have 522 labels that a nurse or healthcare aide has to see or examine before they can finish their charting. And this type of charting is done multiple times a day. So, goals that we had are to improve the flowsheet's functionality, the quality of charted data, charting efficiency, and ultimately increase time for patients or nurses with their patients. Now, an objective that we had was to develop a systematic and repeatable strategy to evaluate content of a flowsheet and then apply that strategy to any flowsheet. Now, the methods we took are broken down into two steps. We have a problem analysis and we have a content analysis. Now, in the problem analysis, we defined rules of thumb or heuristics by which stakeholders would like flowsheets to operate by. Then we had to develop a heuristics-based assessment tool, which my partner in crime, Brandy Thomas, will expound on in her project presentation. And this assessment tool is based on the Nielsen's heuristics. Now, in our content analysis, we input all the flowsheet categories, data elements, and values in an Excel document. We also included columns detailing the heuristic evaluation findings, heuristic violation severity levels, and our recommendations for change. Within that Excel document, we used pick list functions that allowed us to easily organize the different violations that had occurred throughout the daily cares flowsheet. And then ultimately, we presented all of this information and our heuristics tool to the Electronic Nursing Documentation Committee, which comprises of some leaders and stakeholders throughout the University of Utah healthcare system. And they provided us feedback and approvals for our recommendations. Now, the results that we had were that we found 263 violations observed, 24 of which were minor usability problems, and 293 which were major usability problems. Now, you can see a sample of our heuristics violation findings in the daily care flowsheet here in the middle. You can see one particular section labeled A, or the aesthetic and minimalistic design, and its subcategories A1 through A8. You can see particularly in A1, 56 violations, and A4, 127 violations, that we had a significant amount of violations just in this category. A1 specifically refers to no unnecessary documentation, such as data elements that are already reflected in the patient's orders, care plan, or protocol. And A4 is no unnecessary values, such as values that do not reflect clinical workflow, are not relevant findings for the data element, or are not in the scope of work for the user. Some other violation findings include reordering the flowsheet to match head-to-toe orientation. We did this in particular in the hygiene section, where you would think it would be from head to toe that you're documenting, but in fact it was kind of all over the place. Then we found violations related to spelling errors, charting by exception, which is referring to us having a set definition of what is considered normal, and then only charting that which is outside of normal, not normals. And then recognition rather than recall, which is providing brief descriptions to clarify what the nurse or healthcare aide is charting about, or what they're charting when they do. We don't want them to have to try to remember what each thing they're charting means. So we provide a brief description. With our recommendations, the content of the daily care flow sheet was reduced from 10 to 8 categories, 69 to 46 data elements, 443 to 180 values. Thus, the total number of labels to potentially review when scanning the flow sheet is now 44% of the original set. That's almost half of what the flow sheet was. Our recommendations were to remove 2 categories, 23 data elements, and 263 values, reorder data elements to match workflow, and then revise the labels for 3 different data elements and 22 values, and assess usability and efficiency of enhanced flow sheet. In conclusion, the optimization of the daily cares flow sheet will provide improved efficiency for RNs and HCAs and a higher quality of care for patients. Some anticipated outcomes of this optimization project include, but are not limited to, an increased time for patients, less time documenting, improved worker satisfaction and retention, more organized and queryable data for research, and better interoperability between units, departments, and hospitals. I really enjoyed my time with the University of Utah's Nursing Informatics Department, and I really look forward to your questions. Thank you.